Hello, everybody. My name is Thomas H. Menye from the Grantham University, and I'm presenting my capstone project on the topic, the shortage of healthcare staffing. This is one of the major problems our healthcare industry is going through. So we discuss this problem and we recommend a strategic plan to solve this problem. And we discuss and consider few topic and chapters discussed. So let's go down to the content and see what the content have to say. In the table of contents, we consider chapter 1, problem statement, chapter 2, literature review, chapter 3, strategic plan, chapter 4, recommendation and limitations, chapter 5, the references. Now, let us prepare ourselves and go to the next slide and dive in. The background of healthcare staffing shortage. The development of healthcare career was hampered by historical events. The School of Nursing supplied and helped build the healthcare industry into a medical networking system that provided staffing to healthcare facilities like hospitals and clinics. The Great Depression increased the unemployment rate throughout the US, including healthcare staffing. In the mid 1930s, the reduction in nurses' working hours and technological, economic, and healthcare events increased the demand for registered nurses, which led to staffing shortages. By 1936, nurses shortage was reported all over the country. Nurses recruitment during the Second World War also created shortage because nurses did not return to their jobs. However, the shortage of the 1960s lasted about 5 decades and affected the industry across the country. Each healthcare staffing shortage of the mid-20th century happened within a specific context but had similarities in their reasons for occurring, and they were also solved similarly. Healthcare staffing shortage tends to increase the mortality rate and impede the citizens' health, so it needs to be solved rapidly. Nursing school administrators and the early healthcare leaders used three consecutive methods to solve the problem. First, they increased enrollment in nursing schools. Second, they less educated and trained individuals to work along or substitute registered nurses as LPNs. And thirdly, they shortened the learning period to graduate more nurses faster as possible. The strategy worked but did not prevent the repetition of future staffing shortages. And government intervention. The government intervened and passed the Boyton Act of 1943. It provided nurses with free education, uniforms, and monthly stipend, and they were not required to serve in the military. Participating schools were required to reduce the length of the educational period and to meet the program's goal and objectives to increase healthcare staffing. The Hill-Burton Act of 1946 created an opportunity for healthcare structure expansion due to the influx of patients. However, the physical expansion of the hospitals and the increase in patients' hospitalization gave rise to the demand for healthcare staffing. The Nursing Training Act of 1964 was enacted to solve the shortage problem that persisted in 1960s. The Coronavirus Aid and Economic Security Act of March 27, 2020 was signed. It has numerous provisions, including nurses training and sick pay. Governor Andrews of New York called on retired medical professionals to rejoin the health system. However, the healthcare staffing shortage remains unsolved and threatening to increase. They have yet to find a permanent solution to the problem. The effect of healthcare staffing shortage on healthcare organizations. Hospitals, rehabilitation centers, and nursing homes were affected by staffing shortages due to the coronavirus. However, the pandemic inflicted great hardship on nursing homes with high level of COVID-19 infection, high mortality rates among residents, increased healthcare staffing shortages, and insufficient on-hand supplies. The American Nursing Association's principles for nursing staffing describe staffing as a requisite for safe service delivery and quality of care at every practice level in all settings. An interview result shown that nurse turnover leads to staffing shortages, which directly affect the operation of nursing homes. Staffing shortage causes a heavy workload to be placed on a single person, and it causes unusual working hours or double shifts, which affect patient care. Managers and supervisors lack of support destroy motivations and create a poor working environment. Such an environment that does not encourage staff development opportunity can lead to high nursing turnover. As we go on, we see that stress has become one of the major factors that increase nurse turnover, and long working hours poses a physical and mental threat to nurses. Their mental medical risk increases their chances of medical errors due to long working hours and workload. Effect of healthcare staffing shortage on service delivery. The impact of the staff shortage on registered nurses and their effect on performance impact their physical, psychological, social, and family relationships. As a result, it leads to high errors, high injuries, and high mortality rates, and poor healthcare delivery. Staffing shortages affect healthcare delivery and lead to undesired outcome. Effect of healthcare staffing shortage on patients' outcome. Nurses shortage in patient outcomes leads to error, patient dissatisfaction, and high injury and mortality rates. Staffing shortage stimulates nurses' burnout and dissatisfaction, while patients experience higher mortality rates and nurses' inability to rescue patients because of staffing shortage. A strategic plan to address healthcare staffing shortage. To address this problem, a strategic plan was developed. This plan focuses on retention, increasing wages and benefits, improving working conditions, and providing excellent development opportunities. This plan's objective is to improve and ensure the U.S. healthcare system is adequately staffed and employees retained. Looking at the current state of the healthcare industry, the healthcare industry is currently struggling with staff shortages and high turnover. But what will the healthcare environment look like once the problem is solved? When the problem is solved, there will be more incentives to retain, recruit, and provide better and more accessible services with improved technology to meet patients' needs, even during challenging times. Communication and employee buy-in are essential to successfully implementing the strategic plan. It should be communicated to all stakeholders and participating parties to visualize the new system and buy-in. Gaining employee support is very essential to its success. Therefore, awareness of the future healthcare system and its strategic plan must be communicated. Considering short-term and long-term planning, both strategies are vital to staffing success and retention. When the plan is successfully implemented, organizations, employees, patients, and providers will all benefit. What should management do to address this staffing shortage? Management should implement the strategic plan and consider the following for success: cost, labor, and technology to facilitate and implement the plan. Moving to the strategic plan. This study proposed implementing the strategic plan to alleviate healthcare staffing shortages, improve satisfaction, reduce turnover, and improve retention. When implementing this plan, consider the following: hiring the right people, shaping employee growth and development, and provide benefits. Benefits attract employees, for example, a good retirement or insurance plan. Also consider financial incentives such as cash or traveling vacations. Benefits can significantly improve staff retention. On this slide, we continue with the strategic plan. Appreciate employees. Managers and supervisors should consider appreciation. It can go a very long way. It makes staff feel their importance. Managers and supervisors should also create flexible shifts. Flexible shifts allows staff to balance their work and life. It increases staffing satisfaction and retention. At the same time, they should not neglect regular feedback because regular feedback reduces employee turnover and improves staffing shortages. Finally, they should develop programs that encourage leadership and opportunities. Recommendations. We would like to recommend the following 2 points. During this study, a question was raised concerning whether applying a different approach to solving the problem may lead to a better result. The findings of this study shown that low enrollment in medical schools is not the driver of the problem of healthcare staffing shortages, but relatively poor management and the lack of proper policy to protect, interest, and retain healthcare personnel. Secondly, the study recommends implementing the strategic plan to alleviate healthcare staffing shortages and improve staffing retention. We consider the limitations. There are many issues, activities, or events to hamper the strategic plan or to prevent the success of the strategic plan. But here we will consider few of those limitations. And the first one we will talk about is cost. Without funds, the strategic plan cannot be successful. Managers should also consider, or the planners should also consider, nurses and the leaders participating in the implementation process of the strategic plan. The lack of nurses and healthcare leaders participating in the implementation process will hamper the strategic plan. Therefore, their input is necessary to strengthen and reinforce the plan. Limitation, which is very important, looking here at the limitation, the lack of communication can hamper the strategic plan's implementation process and success. Communication is the first and most significant aspect that drives the strategic plan to success. Clear communication leads to leaders and nurses buy-in and the plan's success. With their buy-in, the strategic plan will achieve its objectives. Consider also the political and politicians' environment. Politicians can hamper the strategic plans by politicalizing it or making policy to constrain it. Their clear communication of the strategic plan and its benefit to the political environment will strongly reinforce its implementation by encouraging legislation and policy that support the plan. Therefore, involving the politicians or political community in the plan is vital to permanent success. This research only examined data collected from online databases. The findings could be further strengthened for generalization when healthcare leaders and nurses are interviewed to assess a comprehensive understanding of the healthcare staffing shortages and organizations' ability to implement the strategic plan will improve the healthcare staffing shortages. This is the references that support this study. Thank you for watching. Thank you for listening. The Shortage of Healthcare Staffing, presented by Thomas H. Menier, College of Health, Grantham University. HP 598, Healthcare Administration Capstone Project, submitted to Dr. Janet Andrews on January 3rd, 2023. Thank you.